If you have been suffering from constipation or straining more than usual to pass stool, you could be harming your body more than you think. It's important that you watch this video to the end so you don't miss any important tips on keeping your bowels moving regularly. Quick question: is constipation a disease? Yes or no? Constipation is not a disease, but may be a symptom of other medical problems, affecting about 16 out of 100 adults. The elderly seem to be more vulnerable, affecting 33 out of 100 adults, ages 60 and older. And this condition is more common than you think, sending over 700,000 individuals to the emergency room each year. In this video, we will discuss what is constipation, what causes it, what happens if it lingers, and the best natural ways to treat it. But before we do, remember to subscribe before our next video upload so that you'll never miss another informative video. What is constipation? Constipation is defined as having fewer than 3 bowel movements a week, stool that is dry, hard, or lumpy, stool that is difficult or painful to pass, a feeling that all stool has not passed. What causes constipation? Oily foods, a deficiency in water, not enough fiber, lack of activity and movement, and certain medications. These include iron supplements, some blood pressure medications, and antipsychotic drugs. The biggest culprits, though, are opiate painkillers like oxycodone and morphine. As feces linger in the colon, water is continuously absorbed from them. While this makes feces smaller, it also makes them harder. We will discuss the 5 natural ways to treat constipation. Before we get into the cures, let me be very clear. Straining to push your stool is not a cure. If you are straining or forcing yourself to defecate, stop it immediately for your own health. Because of the way the bowels work, the pushing force comes from the side of our abdomens. Pushing from our core tightens up the anus, while you are forcing more pressure into it, effectively multiplying the wear. Straining causes hemorrhoids, prolapsed problems, where your intestines bulge through your anus, or bladder and bowel problems with this dangerous practice. Stay tuned for our breathing and posture technique to pass constipated stool easily. Also, watch out for chemical laxatives. These should be the last resort. There are more than enough natural laxatives out there, and I'm not just talking about my Aunt Stella's cooking. Number 1. Eliminating from your diet all oils that have been removed from their natural sources, as opposed to the oils naturally occurring in foods like nuts, avocados, and corn. These separated oils leave a film in the stomach that makes it difficult to digest carbohydrates and proteins there and in the small intestine. This delays proper digestion by up to 20 hours, allowing putrefaction and toxic gases, creating a traffic jam in your large intestine. Number 2, drink more water. Water and fiber deficiencies are among the top causes of constipation. Our body needs water. Digestion is no different. Think about it like this. Does your food dissolve better in more or less water? Exactly. Water helps to keep your stool softer, and this makes it easier to flow. It is recommended that the average adult should drink at least 6 cups of water. 8 is preferred per day. While it's not easy to do, you will see improvements in your bowel movements within the week that you meet this requirement. Number 3, more fiber. Like many of the things we discussed, getting more fiber is one of those things that we know we need to do, but it's actually hard to do. So, I will help you by giving you a simple approach. Think less processed foods and think more fruits, grains, nuts, and vegetables. Now, pick one food item out of the 4 groups and incorporate it into your diet by first creating a list of 4 foods that you know you need to eliminate from your diet. Choose a healthy option to replace the unhealthy food you want to eliminate from your diet. Remind yourself that you are doing this for your health over time. Number 4, get moving. Though pushing on the toilet isn't the best thing to do, tightening your abdominal muscles while doing other things does wonders for your colon. The contraction of your core aids in the peristaltic movement of your intestines, causing food to move through your system faster. It can also remove annoying gas and slim down that bloated gut. Going to the gym, running, jogging, doing light aerobics, or walking can make your stool move more regularly. And number 5 is the unique breathing technique that will help you pass stool easier. As we stated earlier, pushing and straining is the worst thing you could do for addressing constipation. It leads to worse problems, including hemorrhoids and the need for anal surgery. There is a technique that you can try in your home that will relieve constipation and prevent embarrassing anal conditions. First, while sitting on your toilet, elevate your knees slightly higher than your hips. You can use a stool, or even better, place 2 rolls of toilet paper beneath your feet, legs apart. Next, lean forward, keeping the spine straight. Place both hands on your knees. Then, take in a deep breath through both your nose and your mouth while expanding your belly. Any singer will tell you that this is the proper way to take a breath. Release the breath slowly in the same manner. This technique works because when your lower tummy bulges forward, it opens the anal sphincter and helps to release the pelvic floor muscles, which allow you to pass stool. Trying any or all of these solutions will no doubt help you to overcome any bout with constipation. We would love to hear from you. If you have any little known natural remedy to share, please leave them in the comments below. If you think this video helps, give us a thumbs up. If you subscribe and activate the notification bell, we will always let you know when there is another helpful video that comes out. Remember, stay healthy, stay happy.